What are the 5 major benefits of intermittent fasting? So I think the first has to be weight loss. I mean, most people I talk to that want to do intermittent fasting, that's the first thing they say is, I'm doing this for weight loss purposes. And I think that's fine. I think in the long term though, you'll tend to change your mind. You'll do it for other reasons that I think are far more beneficial. But that's fine to start with. So the idea is that for intermittent fasting, you're limiting the amount of time you can eat in a given 24-hour period. Now there's a variety of ways to do this. So there's a 5-2 method, which is basically you're eating for 5 days and you're fasting for 2. There's an alternating method where you eat one day and fast one day, and there's you can mix and match all that. But the one that I prefer and the one that I do is actually time-restricted eating, which is another term for intermittent fasting, where you're limiting the amount of time you can eat in a given time window during the day. So a real common one is 16-8. So you fast for 16 hours and you eat for 8 hours. There's also like a 14-10, there's a 12-12, and the idea is there's a certain amount of time that you fast and a certain amount of time that you eat. So in the 16-8, you're trying to eat a normal diet in that 8 hours. You're not gorging yourself, you're not trying to eat a lot of high fat, high sugar foods, right? You're having a well-balanced diet. But you're trying to eat maybe 2, maybe 3 meals in that 8-hour window. That's kind of tough. Actually eating 3 meals, I've tried that, that's not easy. I tend to do 2 meals and a couple of snacks. But the idea is that during that 8-hour window, when you're eating, your body is burning glucose, it's burning sugar, right? Because that's the easiest thing for it to burn. And it's storing all the excess as glycogen. So the glycogen then gets stored in your liver and muscles. And then when you stop eating and you go into the fasting cycle, your body starts to pull the glycogen from your muscles and your liver to act as fuel. And then once that's depleted, it starts to burn fat, it starts to burn fat cells. And that's the idea behind losing weight when you're doing intermittent fasting, is that you're burning fat for a certain amount of time every day. So the idea is that you intermittently fast throughout the week, 7 days, and 16 hours or 10 hours or 14 hours or whatever that time period is where you're not eating, you're just drinking water, your body is starting to deplete fat cells. Now, you could be really aggressive and you could say, well, I'm going to do a 24, right, which is 20 hours of fasting and 4 hours of eating. But the problem with that, I find, is that that's really difficult to maintain. So you want to find something that's easy and you can maintain it, and you can have consistent weight loss or consistent fat burning cycles in that fasting period over time. So the second benefit or reason to do intermittent fasting would be improved blood sugar levels, or the improved or enhanced sensitivity of insulin in the body. Now, insulin is the hormone that regulates blood sugar, so the body cells actually become more responsive to insulin. So when you eat carbohydrates, as an example, it gets turned into glucose in the body, that gets into the bloodstream, and in order for the glucose to get into the cells, it has to use insulin as a transport. Now, there's been several studies, and I'll put the links in the description below, that show that intermittent fasting actually regulates blood sugar and insulin, and it lowers them both. So there's lowered blood sugar and lowered insulin, and it takes out the highs and lows. So you have this steady state of both at lower levels throughout the day. So the third benefit, or the third reason for intermittent fasting, and personally what I feel is the most important, is the process of cellular repair, or autophagy, which is the process of breaking down poor quality cellular tissues. And actually autophagy means the body eating itself or breaking itself down. So in the fasting cycle, in the fasting period, your body is actually starting to break down poor quality cellular tissue. So poor quality proteins, old dying cells, precancerous cells. And this is really, really important for your body to break down all that stuff and get rid of it. So during the fasting cycle, you're breaking this stuff down and you're eliminating it from your system. Now, the other thing is that you can start to get into different types of fasting or intermittent fasting to enhance that process. So as an example, let's say you're doing the 16-8 cycle, right? You're fasting for 16, eating for 8, or you're doing 14-10 or 12-12, whatever. On the weekends, you might want to do a 24, right? So 20 hours of fasting, 4 hours of eating, right? To enhance that autophagy or that cellular repair process. Or maybe even you want to go a day without eating. You actually want to have a whole day fast, just drinking water. So you can mix and match this to help accentuate that process. The other thing that happens is you're also able to decrease inflammation within the body. So there's a lowering of the inflammation or the markers of inflammation. And then you're also giving your body a break from digestion. So that helps with gut health or your gut biome. So number 4 would be brain health or improved cognitive function. And there's some studies that suggest that intermittent fasting could help promote the production of a protein called brain-derived neurotrophic factor, or BDNF, that supports brain health and neuroplasticity and could potentially reduce the risk of neurodegenerative diseases. Now, I think if you couple that with the anti-inflammatory effects of intermittent fasting or the reduction of systemic inflammation, you could potentially avoid things like Alzheimer's disease and other neurologic disorders. So at number 5, in my opinion, would be cardiovascular health. And that's really from the benefits of the self-regulating effects of intermittent fasting. So I talked about blood sugar and insulin sensitivity earlier, but you're also going to lower blood pressure, you're going to lower and regulate cholesterol, triglycerides, and of course you're going to lower inflammation. And those are all risk factors for cardiovascular disease. So what I tend to recommend to patients is let's come up with a fasting or an intermittent fasting plan that works for your lifestyle, works for your schedule, your work schedule, and it's something you can do on a daily basis for the long term. So it's not a short thing you do for a couple of months and give up, but you actually do something that you can consistently do over a long period of time. So you're improving your health, but you're also avoiding some of these diseases that over the long term could greatly affect your quality of life.